Surgery was always my passion, but now I have a three-digit rank. Should I take radiology? Or I can't get my dream branches. So what branch to choose? And what to choose if I get chance in a distant college? Well, these are the questions that are clouding your mind since your NEET PG counseling is coming. So today I will give you a guideline on how to choose subject. It will be easier for me to explain in the form of an algorithm. Now, why have you stopped being an MBBS and want to qualify for the NEET PG? It will be the bettering of the quality of life, right? Broadly, these are the four things that people strive for: passion, money, fame, and work life balance. And for the next part, do some soul searching and classify what you need under these three headings. Firstly, the things you can't live without. Second, the things you want. And thirdly, the things you are willing to sacrifice. Now, under these three headings, classify the four things that I just mentioned. For example, for me, when I qualified NEET PG, I knew what I wanted. The things that I live for, the things that I can die for, are passion and fame. The things which I want is money. In the sense that between money and fame, I will choose fame any day. And the things that I am willing to sacrifice included the work life balance. I can live without it. Now, these are what suit me personally. Yours will be different. Don't lie to yourself while preparing this table because it might cause problems in future. And now coming to the choice of subjects. For me personally, I had a rank of 639 and I always had a passion for surgery. But does it fare well with my algorithm on the other aspects? Firstly, to check for the things that I can't live without. Those are my passion and fame. Well, surgery has the potential to offer me both, so I am okay with it. Now coming to the next thing, that the things that I want, that's money. With time it will come. And for the third thing, that is the things I am willing to sacrifice, that I can live without. That is work life balance. So it fits in perfectly. So surgery was my choice. It was clear to me as daylight. But then came the negative counseling. For every people that I asked, they gave me the same reply. You have a good rank, so you should take radiology or medicine or dermatology. So rather than giving in to peer pressure, I put it in my technical terms. That is my algorithm. Firstly, radiology. It has money, it has work life balance, but I don't really have a passion for it. And as for fame, radiology doesn't really offer you that. For example, every USG or CT scan anyone has gone through, they don't really remember the name who has done the reporting of it, right? Well, there will be fame if you become an interventional radiologist, but that's very much similar to surgery, isn't it? Now, these are my thought process 3 years ago. If the algorithm of radiology suits you and you are okay with it, then go for it. Don't think twice. And now coming to medicine and related subjects like dermatology or chest medicine. Like, it offers you more or less everything, be it earning potential, work life balance, and fame. But I don't really have a passion for it. But then again, if you have a passion for medicine, go for it. Don't think twice. So, this is for the algorithm part. You can do it for the subjects available at your rank and put it similarly and see what you want and what those subjects can offer you. And now, coming to the next part. I know I want to take up surgery, but is it really a viable option? So rather than just jumping in, first I have to determine, can I survive? So I contacted my UG college and my seniors there, and I did 2 proper admission days with a surgery unit. And when at the end of the day, at 6 o'clock in the next morning, by staying up whole night, I can still feel that this operation theater is the place where I can spend my entire life in. Then only I decided that I will take up surgery. So my suggestion to you is first determine what you are getting yourself into. Firstly, talk to the professionals who has passed in the recent time, say 3 to 5 years ago, and how they are going about with their lives. And secondly, go to your UG college and talk to your seniors, your faculties, and have a realistic view on how your life will be as a PGT and can you survive that. The next point that I will like to put my emphasis on is snap back to reality. The way you have seen the world through the eyes of an intern or a house staff is far different what your world will be once you become a PGT or a professional. So get a realistic view. Don't just take up medicine or infectious disease because you idolize Dr. House, or take up surgery because you idolize Dr. Sean Murphy from The Good Doctor, or anyone from the Grey's Anatomy. See, the life, the way it works, is far different from what is shown in TV series. The next point that I would like to make is put your branch above college or location. See, choosing a branch is like getting married. The wrong person can ruin your life, and divorce, and in this case, the seat leaving penalty can be quite high. So choose carefully. For example, say you want medicine, but you are getting only peripheral colleges. But if you want a better college, you are getting pediatrics. But deep down inside, you know you don't want to deal with anxious mothers and their child your entire life. If that's the case with you, take up medicine in the peripheral college. On contrary, if you are okay with dealing with children and their anxious mothers, by all means take pediatrics. For the next part, I want to specify something. The money that I mentioned in my algorithm part of this video refers to the earning potential. It's not the definitive money that you get. Money is not directly related to what specialty you take. It depends on your hard work. More specifically, how you talk to your patient, what is your communication skill level, and how those patients think of you so that they will bring more patients to you. And that is what I refer to as fame. You can totally be a radiologist and make less than a GP if you are lazy enough. I have seen GPs outperforming their MD counterparts, and these things are very common once you step outside the four walls of your institution. In conclusion, branches have earning potential. The kinetics will depend entirely on your dedication. So, in conclusion, first, what you should do is soul searching and see what you want in your life. The second step, see which are the specialties which can fulfill your dreams. And thirdly, give yourself a reality check by doing voluntary work in that department of your, say, UG college, and then only take decision on which subject you should get into. Surgical branches have the highest dropout rates. If you have any specific queries, write down in the comments, or if you don't want it to be public, then you can email me here. Thanks for watching, and hopefully this video helps on your NEET PG counseling.